Hi guys, so welcome back to my YouTube channel. In this video, we are going to discuss the INICET recall for dermatology. As you can see, there were not a lot of questions from derma this time. So the first one is, which of the following drugs used for leprosy causes skin pigmentation? The options are dapsone, clofazimine, oflox and rifampicin. The answer would obviously be clofazimine. Let me show you two patients. They have this orangish hue. This is not her original color. I saw her for 2 years. I could see a visible color change on her skin. This patient again has an orangish hue to his face. So basically clofazimine causes dyspigmentation of face. A common confusion would have been between rifampicin and clofazimine, but let me tell you that rifampicin causes discoloration of secretions like sweat and tears and all of that. It causes a reddish orange discoloration of all the secretions. So it's not that rifampicin causes discoloration of skin, it causes discoloration of the secretions. Now another question is, annular lesions are not seen in urticaria, perosia, tinea, porokeratosis. Let me show you the picture so that you can understand it better, because the thing is, a lot of you have got this wrong. This lesion is porokeratosis. Even if you didn't know what porokeratosis is, you guys should be able to imagine that urticaria happens when mast cells burst. Okay, mast cells usually burst in the skin layers, and when they burst, there is a leakage of fluid from the vessels, and that fluid can seep in any direction, and that will lead to swelling of the skin in a wheel-like manner. So urticaria basically happens due to mast cell degranulation, which causes leakage of fluid from the blood vessels, and thereby thereafter there is a swelling of the skin. So you can see that fluid can flow in any direction. The skin swelling hence also can happen in any fashion. It does not have to be annular per se. Now the next question was P. rosea. The next option was P. rosea. P. rosea, again, it has this collarate of scale. You know, can you see this shirt? I'm not like, I used to draw a lot as a kid, but I don't draw now, so my drawing, forgive me for not drawing so well. But then if you could remember, there are collars on your shirt. So what happens is, there's a part of your shirt that goes up and folds like this. Just like that, a part of the skin has gone up and it's slightly raised. So that is called a collarate of scale, which we see in P. rosea, and it is again in an annular fashion only. Now tinea is very easy. Another name for tinea itself is ringworm. So if ringworm or tinea, if you talk about tinea or ringworm, it has to be round or annular, right? So that is the thing. Now another question was, which vitiligo after some time becomes stable and non-progressive? Obviously the answer would be segmental here. This is a fact-based question. Another fact-based question is, which STD has got resistance now? So out of syphilis, gonorrhea, donovenosis and chancroid, gonorrhea has developed resistance to sulfonamides, penicillin, tetracycline, etc., and also to fluoroquinolones. That is given in a lot of articles on PubMed, and according to the student who has recalled this, it is given in some micro textbooks also. So resistances and all are important, because these are some new things that are coming up in the market. The next question was, a female had painful genital ulcers 1 year back. Now she has a baby who has vesicles and meningitis. So see, if painful genital ulcers, if we talk about painful genital ulcers, there are only two differentials. One is herpes, another is chancroid. Now in herpes and chancroid, multiple ulcers are more commonly seen with herpes. Also, herpes causes molarate meningitis or temporal meningitis in people. So what basically must have happened was, the mother might not have had active lesions, but herpes might be dormant in the mother. When the child got it, he got symptoms of meningitis and a little bit of vesiculation as well. And this thing, the painful genital ulcers of herpes, are seen due to HSV2. So here the answer would be HSV2. Now another question was a match the following kind of question. We all know that for tinea we have to do KOH mount. For leprosy we do split skin smear, wherein we take a sample from the patient's earlobe and we smear it on the slide, and then we see it. Then biopsy is obviously done to confirm any skin lesion that we are suspicious of, which we cannot diagnose clinically. We go for a biopsy. And for all sorts of allergic dermatitis, we have to do patch tests. Now let me tell you one more thing here. So these are basically, there is a topic called lab diagnostics in dermatology which we skip, but then zinc smear is something which you have to read. Patch test is also something that you have to read. So basically what happens is, if you have a person, let's say this person, in patch test what we'll be doing is we'll just be attaching a few we'll tape a few allergens over the back of the person, and those allergens would cause erythema if the person is susceptible to them. So this is the whole concept of patch test. You take a few allergens, you attach them to a patient's back, and then you see whether or not the patient has allergy. After that we had KOH mount. So in KOH mount also we basically scrape the skin. When you scrape the skin, the scrapings that you get, you put them over a glass slide, and then you observe that glass slide. Then you put 20% KOH over that glass slide and you observe it under microscope, so you'll be able to see some fungi and all. That was about it. Wood's lamp is also important. It was asked in NEET this year, so I think this commonly ignored area is becoming increasingly important these days. So yeah, that was all about the INICET recall for this year. Let me know in the comments if you guys want me to add any question, if you want me to make any improvements. I'll be glad to do that. Thank you for watching. You can if you are interested in learning dermatology, you can subscribe to my YouTube, and there's a lot of stuff that I keep putting on Instagram as well. So yeah, I'll see you around.